So acid-base abnormalities are classed as either respiratory or metabolic. And very simply, respiratory acidosis, right, less than 7.35 pH, and respiratory alkalosis, greater than 7.45 pH, is caused by, just like it implies, failure of the respiratory system to perform our pH balancing role. So the most important factor in respiratory acidosis or alkalosis is the partial pressure of carbon dioxide in the blood. All other abnormalities of acid-base balance is classified as metabolic acidosis or alkalosis. So if it's not respiratory, it's metabolic. And those are going to be indicated by abnormal bicarbonate ion levels. So if we're looking at respiratory acidosis first and alkalosis, we have to look at our partial pressure of carbon dioxide. Those levels in our fluids, in our blood, mainly our arterial blood, and their normal level should be between 35 and 45 milligrams of mercury. And that's an easy number to remember because recall the normal pH level in our arterial blood is 7.35 to 7.45. And here we have partial pressure of carbon dioxide at 35 to 45. So kind of worked out nice that way. So if our partial pressure of carbon dioxide is above 45, it's respiratory acidosis. So common cause of acid-base imbalances is this respiratory acidosis, shallow breathing, or any disease causing inadequate gas exchange, like COPDs, like emphysema, pneumonia. Those cause breathing problems. Cystic fibrosis causes respiratory problems. So whenever you can't exchange gases, we can't eliminate carbon dioxide. When you can't eliminate carbon dioxide and it accumulates in your fluids, well, we know now, hand in hand, we have the hydrogen ion accumulating as well, which makes the fluid more acidic and therefore respiratory acidosis. So CO2 accumulates in the blood pH drops because with CO2 comes hydrogen ion accumulation. So look at the previous video to kind of explain how that happens with the equation. And the opposite partial pressure of carbon dioxide is when below 35 milligrams of mercury is respiratory alkalosis. So now this is a result of hyperventilation, just the opposite that would happen in all these inadequate gas exchange conditions. And usually that occurs because of stress or pain. People tend to hyperventilate. So now carbon dioxide is eliminated faster than it's produced. And because eliminating carbon dioxide is also eliminating our hydrogen ions, therefore moving to the higher pHs or alkalosis area. So table 26.3 in your textbook.
And then for metabolic.
Sorry about that. Let's go back here. Sorry. Table 26.3 in your textbook outlines the respiratory acidosis and alkalosis and the possible causes for you. So with metabolic acidosis and alkalosis, we're not concerned with carbon dioxide, but it's the bicarbonate ion instead. So metabolic acidosis, well, acid would mean low pH. So metabolic acidosis, low blood pH and bicarbonate ion. How would that happen? Well, ingesting too much alcohol, because alcohol gets converted to acetic acid. Excessive loss of bicarbonate, because low bicarbonate, losing bicarbonate, perhaps persistent diarrhea is eliminating it, or accumulation of too much lactic acid in the system, exercise or shock, ketosis, diabetes, starvation, right? All of those methods, kidney failure, of why we can have an accumulation of lactic acid, while metabolic acidosis is rising blood pH, right? Getting alkaline or basic, rising bicarbonate ion. This is less common than metabolic acidosis, and a cause would be vomiting, meaning we're losing acid from our stomach, losing acid would mean rising pH because it's getting more basic. And of course, this vomiting would have to be without diarrhea, which would counteract it, or intake of too much base. It's really hard to do that, but if you have too many antacids, I guess that's a possibility where you're intaking too many base. So that would be the opposite of getting rid of too much acid, like vomiting. And of course, we have the table for that here. Table 26.3 compares the metabolic acidosis with alkalosis. So this slide here gives us the absolute limits of pH. We know normal pH in our fluid is 7.35 to 7.45. If it's lower than that range, we call it acidosis. Higher than that range, alkalosis. But the limit for life would be 6.8 on the acidosis side and 7.8 on the alkalosis side. Anything beyond that range is extreme and we can't survive, because below 6.8 in our blood, the pH just depresses our CNS. Our neurons cannot function at that point, which would lead to coma and death. Where above 7.8 is just the opposite. It's not depression, it's overexcitement of the nervous system. Muscles will be contracting uncontrollably, extremely nervous, convulsions, and then ultimately death from respiratory arrest. So these are the 6.8, 7.8, again, could be easy to remember because they're just pH of 1 apart, right? 6.8 to 7.8. Those are the life limits. Now, if we have an acid-base imbalance, because one of the systems are malfunctioning, we went through 3 buffer systems, but we're talking about lungs or kidney, because the chemical buffers are happening all the time. So respiratory or renal, if there's a malfunction of one, well, the other one will compensate, and vice versa. So a patient may have a normal pH even with a respiratory problem or with a renal problem because the other system is taking over. So a respiratory system can't compensate for a respiratory acid-base problem, like acidosis or alkalosis. A renal system cannot compensate for an acid-base renal problem, but they can compensate for each other. So if the respiratory system is imbalanced, like a COPD, emphysema, well, the renal system can compensate for it. And just the opposite. If someone has renal problems, well, the respiratory system can compensate for the acid-base balance. So they can compensate for each other, but not for themselves. So in respiratory compensation, that's when the lungs compensate for metabolic or renal pH problems by doing what they know how to do, is changing their respiratory rate. So in metabolic acidosis, your respiratory system will increase rate of breathing to eliminate more carbon dioxide, therefore eliminating hydrogen ions and raising pH. Just the opposite, in metabolic alkalosis, your respiratory system will compensate by decreasing breathing, therefore maintaining carbon dioxide in your system and hydrogen ions, therefore lowering the pH from alkalosis toward a more acidic and normal reading. And renal compensation is when the kidneys compensate for pH problems caused by the lungs. But instead of adjusting the carbon dioxide, of course, the kidneys do what they know how to do, and they'll adjust the bicarbonate levels like we know they can. So in respiratory acidosis, well, the kidneys will reabsorb more bicarbonate to create new bicarbonate and secrete more hydrogen ions, because remember, they're swapped for each other. So secreting more hydrogen ions, which means they'll enter the urine, that acidosis will go in the other direction to normalize. So in respiratory alkalosis, the kidneys will excrete more bicarbonate ion, therefore will absorb more hydrogen ion, so that alkalosis will start to, that pH in the alkalosis will start to lower back to a normal level. So we see how one system compensates for the other.